patient has been brought in by ambulance with suspected head injury, spinal cord injury and fractured pelvis following a motor vehicle accident. Cervical collar is in situ, the patient was stabilised and is on a spinal board, and analgesia, which is morphine, has been applied. IV fluids has also been commenced, and that was normal saline, and a catheter has been inserted for patient comfort prior to our primary assessment.
Hi Bill, I'm Donna. I just need to check your airway. Now, an airway should be taken with a person who has spinal or possible spinal cord injuries, head injuries, the cervical collar is in situ. I need to check your head for any bleeding, any possible fractures, bruising. I can see some bruising here on the cheekbone, maybe on the mandible. Possibly, just Bill, can you open your mouth for me, please? Patient can respond. I can see some possible fractured teeth. I think if I can try and move him out. I cannot hyperextend the head or neck due to the possible injuries. I also have a suction. Just light suction. There's a little bit of vomitus in his mouth. If there was extensive vomitus or debris, we would do a log roll to excavate that. His airway, by looking, I can see his chest is rising normally. Listen, I can hear a slight wheeze. He could have possibly pneumothorax or diverted trachea. If Bill had a compromised airway, we would secure that with the Goodell's airway. We would not use nasopharyngeal due to his possible facial injuries. If he had a GCS and he was unconscious less than 8, he would then also need an endotracheal tube to be inserted. If patient is responsive and respirations are regular, then we could just get him prepared in a neutral position, ready for X-ray.
We are putting our ear to their mouth. We are looking for a rise and fall of the chest cavity, making sure that it's even on each sides. We're checking rate and depth of our patient's breathing as well. In listen, we're listening for an escape of air from the nose and mouth. We're listening for sounds, and he does have a wheeze present, but there doesn't seem to be distress by any of that. We're feeling for movement of the chest and upper abdomen, and feeling the patient's breath on our cheek as well. If there is breathing present, we apply oxygen without trying to move his body as much as we can, and we can continue to administer analgesia. If there's no breathing, we would use a bag and valve device, which is over here, which is just in case it's ready, or if that doesn't work, we would intubate him. That's it.
Okay, with the circulation, we have to check patient's pulse, both central and peripheral. The central pulse is present, equal, but weak. And if the pulse doesn't present, we have to commence the ventilation. And we have to check the BP, which is already on. Yes. And we have to check patient's peripheral real time. Okay, it should be less than 3 seconds. If the capillary refill time is greater than 3 seconds, that means the circulation is poor. And we have to check the skin color and any cyanosis on the lip, and the warmth, touch the skin, to check the warmth of the skin.
Yeah. Okay.
Ready? Hi, external, I'm Amy. I'm just going to check that all your nerves aren't affected by your accident. Check your response to light. And that seems fine. Can you open your eyes for me, Bill? Beautiful, thank you. Yeah. Let me know if you can feel me pressing on your thumb or finger. Can you push against my hand for me? Equal strength in both. And with your feet, equal strength again. Can you feel that, Bill? Brilliant. Kathy, can I get you to help me do a log roll, please?
Yep, no worries.
Normally the patient's bodies would be cut off to see all internal and external injuries. Slight bruising and swelling around his pelvic area, but there's a few small cuts and grazes. Thank you, Kathy. We'll send off a few blood tests to see if he has any alcohol on board that could be affecting his conscious state, as well as a cross match and air blood gases. Make sure there's not any chemical exposure. You keep him warm with some warm fluids and blankets and humidified liquids.